It's Monday, September 15th, 2025. Good day to all of you. I'm Kemi Oshukoya reporting from the White House, where earlier today, the Trump administration announced $50 billion investment in rural healthcare system across the nation. That is a 50% increase from the usual investment that is distributed from Medicare to rural community. This investment will be distributed over the next 5 years, $10 billion each year over the next 5 years to rural community, and it will go towards improving healthcare workforce in this community as well as telehealth, more providing mobile healthcare clinic to those areas that's very far off, where people that live in those areas travel miles to get the healthcare services that they need. It will also, some of those investments will also go towards providing mental health services, providing education on some of the diseases, illnesses that affect Americans, such as diabetic, such as cardiovascular diseases, heart diseases that we know affect many Americans. So the investment will go towards this. I mentioned also that the investment will go towards telehealth, maternal health as well. So it's a huge investment. It's a huge a pivot away from what is usually done. As we know that this is one area that the administration has focused on, the president, on lowering the prescription price, building on what he did during his first time as well as what the previous administration before him just now did in lowering prescription healthcare prices for Americans. So this investment is building upon that. The investment is allocated, part of the money that were allocated in the big beautiful bill that the president signed in July. So the $50 billion will be distributed over the next 5 years to community. In doing this, to get this, the administrator spoke with us on the phone this morning that they work with governors across the nation as well as with companies across the nation to see what is needed in this rural community across the nation. So the feedback that they received from this governor is how they were able to customize, and this investment, as I mentioned, will be customized to each community. As we know, the rural community in Alaska, the rural community in Virginia is totally different from the rural community in the state of New York or in the state of North Carolina. So these investments will be customized to each community, and the administration is looking at working with companies. They are asking companies to apply for new funding for this, to work with them, apply for funding to work with them. So the health services that in a lot of where we call health desert can be improved, and the life of those that live in those areas can also improve. The administration, I asked one administration regarding what can be done regarding the healthcare workforce. They said they are still working on some of those details, but a significant investment will go towards working with organizations to bring more people, nurses as well as doctors, back to this community so they can help improve the life. We know that there's been reports that a lot of these healthcare, because of lack of funding, they have closed. So this is pivoting, turning around for what was done previously to bring more access to people that live in this community. It's a significant investment that we improve people's life. People that we know that some people are moving from urban to rural community, but the customization we improve. In working with this, they work with governors, as I mentioned, to see what is needed in this area, and they said they with the administration will continue to work with governors as well as company to bring the best healthcare system and services to those that live in those communities. We know, as I said, the administration have lower prescription prices, building on what was done during the first Trump administration and what the previous administration have done in lower prescription prices for Americans. So this is building on top of that. And I will be bringing you more additional updates on this important news that affect, as we know, health is wealth. And this affects almost as much as it affects rural America, it also affects other America, because we know what happened in rural America affects the urban area and the rest of America. So this is a significant investment for those that live in the rural community as well as for the workforce.